Swine flu has taken at least 1,000 in U.S. so far, and as many are ill now as during winter peak of regular flu season, officials say. Federal health officials say swine flu, or H1N1, is more widespread now than it's ever been, and it's increasing. The Centers for Disease Control and Prevention says there is as much illness now as the winter peak of regular flu seasons. CDC officials said Friday that swine flu has resulted in more than 1,000 deaths so far, including at least 95 children's deaths since April. Public demand for the new swine flu vaccine has caused long lines and frustration in several parts of the country. But worries about flu has also prompted record interest in seasonal flu vaccine as well. About 60 million people have been vaccinated already, an unprecedented number for October. Most seasonal flu shots usually aren't given until later in the fall. The government's latest data or figures show that swine flu is widespread across the country and increasing in almost every state. 46 states now have widespread flu activity. The only states without widespread flu are Connecticut, Hawaii, New Jersey, and South Carolina. Nearly all of the flu cases are H1N1. There are at least 2 different types of flu causing illnesses now. Testing from approximately 5,000 patients suggests that nearly all the flu cases are swine flu. At least 5,000 people worldwide have died from the swine flu so far, since it emerged earlier this year and developed into a global epidemic or pandemic, the World Health Organization has said. WHO, or WHO, said there were 4,999 total deaths through October 18th that they know of, and most of them in the Western Hemisphere. The figure was up 264 from just a week earlier. And Iceland had its first swine flu death this week. And WHO said Sudan and Trinidad and Tobago also reported initial deaths from the virus this week also. In London, drug maker GlaxoSmithKline said children may only need 1 shot of its swine flu vaccine to be protected. In a statement issued Friday, Glaxo said 1 dose was enough to boost children's immune systems to fight the virus, based on data from a trial in Spain and 200 children aged 6 months to 3 years. Glaxo's finding is in contrast to experts' expectations that children would need 2 doses, since their immune systems are weaker than those of adults. This is causing some confusion. Last week, a rival vaccine maker said children would likely need 2 doses of vaccine against swine flu or H1N1. So which is it? It's hard to tell. Approximately 1 in 5 U.S. children had a flu-like illness earlier this month, and most of those cases likely were swine flu, according to a new government health survey. Approximately 7% of surveyed adults said they'd had a flu-like illness, the survey found. The information comes from a household survey of more than 14,000 adults done in the first 11 days of October. The adults were asked if they had a fever or other flu-like symptoms in the past week. A smaller number were asked about their children. Swine flu is now widespread throughout the country, and the virus is causing more illness now than it has at any time since it was first identified in April. In people ages 5 to 64, there have been as many flu-related hospitalizations in the last 6 weeks as there usually are in the entire flu season, said a CDC flu surveillance official. Also, the number of swine flu deaths in children since the start of September roughly equals the number in the first 4 months of the pandemic. Millions and millions of Americans have now been infected, CDC officials estimate. And what about the second wave, if there be one? And could this mutate into something even worse? And this is a warning. Something's not right in the world. And these are more signs of the end times transition days. Something more going on here. And the transition is a process that's going on, that's happening day by day all around the world. And there are many signs.